Today we're talking about one of the most expensive mistakes in biotech development. I hear this from biotech founders all the time. CMC? We'll figure that out later. Let's just focus on the science first. And it's one of the most expensive mistakes they'll ever make. Here is the reality check most founders never see coming. Because what founders think is this: CMC is just manufacturing. How hard can it be? Does this sound familiar? We'll hire some advisors when we need them. Or this one, the CDMO will handle everything. Or let's get proof of concept first, then worry about CMC. But this is actually what happens. Process development takes 12 to 18 months longer than expected. You will see quality issues that force you to restart manufacturing, and regulatory submissions get rejected for inadequate documentation. And you know what? Your runway burns while you're stuck in CMC limbo. Here is the truth. CMC is your drug's infrastructure. Ignoring it early means paying 3 times more later in time, in money, and missed opportunities. Here is what should keep you awake tonight. According to an FDA analysis of oncology IND submissions, over 40% of unsuccessful IND filings were related to CMC problems, predominantly from sponsors with limited regulatory experience. Not inadequate efficacy data, not safety concerns, CMC issues. While you're listening to this, patients who could benefit from your breakthrough therapy continue waiting because founders keep believing the most dangerous myth in biotech. Science first, CMC later. I'm David Brühlmann and welcome to the Smart Biotech Scientist, and today I'm going to show you exactly why this thinking is killing promising programs and give you 4 specific actions to avoid becoming another statistic. Let me tell you about the most expensive technology transfer of my career. It will show you what CMC later actually looks like. You know, one day our development VP said, well, we have a quick and straightforward tech transfer. We have made clinical batches before. It's gonna be a piece of cake. Except regulatory requirements had evolved. Quality standards had tightened, and our quote-unquote robust process from 3 years ago was now a fragile house of cards. With timeline pressure mounting, we tried to fix everything at manufacturing scale. This is not a joke, at manufacturing scale. Essentially doing process development in a GMP facility. Don't do that. It's not a great practice. Every failed batch costs us weeks and hundreds of thousands of dollars. What is the lesson? What looks like a simple CMC challenge usually isn't. And by the time you discover that, you're already bleeding time and money. Let's talk numbers, because that's what your boards or your investors actually care about. You know, a systematic CMC approach probably takes you around 10 to 12, maybe a little bit over 12 months to IND filing, and most of the people hit those stated timelines. But the figure it out later approach might be 15 months, it might be 24 plus months, and less than 40% success that you succeed. This perfectly illustrates what I heard from a startup CEO. I had a conversation with her and she told me that their team initially believed they could complete the tech transfer from R&D to the clean room settings in just 6 months. A timeline that experienced professionals know typically takes 9 to 12 months, even between established CDMOs. What was the reality? It took them approximately 2.5 years, despite being supported by experienced quality personnel. While this was actually impressive for a first attempt with a small team, it demonstrates exactly how the figure it out later approach consistently underestimates timelines. This startup's experience reinforces what FDA data shows. These delays aren't just theoretical. They represent real founders facing the harsh reality of CMC development when approached without systematic planning. Every month of preventable delay isn't just a business metric. If your therapy could help 10,000 patients annually, every month means roughly 833 people don't get treatment. That's just not acceptable when the delay is preventable. Let me give you the 3 myths that kill CMC programs. Myth number 1. CMC is basically just manufacturing. Look, I get it. You are a scientist. You think about molecular mechanisms, not process parameters. But CMC encompasses process development, analytical development, quality systems, regulatory strategy, and supply chain management, and also risk management. It's easily as complex as your discovery research, and mistakes are far more expensive to fix. Here is myth number 2. We'll bring in experts when we need them. Here is the problem with that myth. The best CMC advisors are booked months in advance. More critically, the CMC decisions you make in your first 6 months determine your options for the next 5 years. You can't retrofit a smart CMC strategy any more than you can retrofit a well-designed clinical trial. Myth number 3, our CDMO will handle the complicated stuff. Well, CDMOs are service providers, first of all. Even if many claim it, they're not always strategic partners in your success. They'll execute whatever plan you give them, but if you don't have a plan, they'll do what they think is best. And their choices may become your expensive problem when the FDA asks hard questions. Here's the deal. The data is clear. Inexperienced sponsors struggle with CMC issues while systematic approaches lead to more predictable outcomes. So let me give you a 4-action protocol to prevent all these problems. Because stop hoping CMC will work out. Start implementing systematic approaches. So here is what I want you to do this week. Action number 1, the reality check. Can you clearly answer what are the 3 most important CMC activities we need to complete this month to stay on track for IND filing? If you hesitated, your team is making daily decisions without understanding priorities. This is not sustainable. Action number 2, have a quality by design workshop. Block 2 hours with your core team. Define, if you have not done that, define your quality target product profile, which is the prospective summary of quality characteristics that ideally will be achieved to ensure desired quality, taking into account safety and efficacy. And look at the critical quality attributes, the physical, chemical, biological, or microbiological properties that must be within an appropriate limit, range, or distribution to ensure the desired product quality. Don't overthink this. Ask what attributes absolutely must be controlled. What measurements tell us our process is working? What would the FDA expect us to monitor? These become your quality foundation. Here is action number 3, an expert input assessment. So identify and start conversations with an experienced CMC advisor, not when you hit problems, now in this very moment, while you can still prevent them. The investment in early strategic guidance is trivial compared to the cost of late-stage crisis management. And finally, action number 4, do a CDMO partnership audit. If you're working with a CDMO, honestly evaluate this relationship. Are you providing clear strategic direction or hoping they will figure things out? Do you maintain control of critical documentation or are you dependent on their interpretations? These aren't suggestions for someday. They are survival tactics for this week, so do all of the 4 actions this very week. Because while you're debating whether CMC deserves attention, your competitors are executing systematic development programs. Here is something that goes beyond business metrics. Every month you delay IND filing is a month patients can't access your potentially life-saving therapy. Your breakthrough discovery doesn't help anyone if it's trapped in CMC chaos. Your elegant molecular mechanism means nothing if you can't manufacture it consistently. Your promising preclinical data becomes irrelevant if you can't navigate regulatory requirements efficiently. You know, science without execution is just intellectual exercise. Your patients, and by the way, your investors, expect both. I just gave you 4 immediate actions to stop the chaos. But in part 2, I'm going to show you the systematic approach that prevents these issues entirely. You'll get the exact 5-step framework that transforms CMC from crisis management into a competitive advantage. The same system helping founders file INDs predictably while competitors struggle with preventable delays. But here is the critical point. Part 2 only works if you complete today's 4 actions. Don't just absorb information of this podcast episode. Implement it. This is how you're going to see change. So hit the pause button right now and start making a plan and implement these 4 actions. Because systematic CMC isn't about having better theory. It's about building better execution habits. For those of you listening who are working on monoclonal antibody programs, I have developed a comprehensive, ready-to-use CMC dashboard that implements everything we've covered today, plus the systematic frameworks we'll explore in part 2. This Notion-based system gives you the complete proven roadmap that successful MAP programs use to reach IND filing in about 10 to 12 months. It includes multiple dashboard views showing tasks, key activities, your timeline, and gives you also risk alerts. And you even have a view which shows you all the immediate actions this month. But most importantly, it's ready to go. So you can solve some of the chaos already right now. No setup required, but fully customizable to your specific program. The Notion dashboard helps you move from CMC chaos to predictable execution, from timeline anxiety to board confidence, and from regulatory surprises to submission readiness. It's designed specifically for biotech founders like you who understand that systematic CMC development isn't optional, it's essential. So if you want to learn more about this dashboard, use the link below. You will also find a 5-minute walkthrough and you can see if this is something you could use. Smart biotech scientists, thank you for tuning in today. Please take a few seconds to leave a review on Apple Podcasts or the platform you found us on. I love hearing from you and I will see you next time in part 2. All right, smart scientists. That's all for today on the Smart Biotech Scientist podcast. Thank you for tuning in and joining us on your journey to bioprocess mastery. If you enjoyed this episode, please leave a review on Apple Podcasts or your favorite podcast platform. By doing so, we can empower more scientists like you. For additional bioprocessing tips, visit us at smartbiotechscientist.com. Stay tuned for more inspiring biotech insights in our next episode. Until then, let's continue to smarten up biotech.